The easiest way to go through the urinary system is break down the nephron into the three main things that are happening. So the first thing that's happening in our nephron is our glomerular filtration. Okay, so that's the first thing that has to happen to form urine. And then we have tubular reabsorption. And that takes us through the tubules, specifically our proximal tubule. And then we have our tubular secretion. Okay, so those are the three main steps to urine formation, right, to make urine. So the first one, the glomerular filtration, if we focus on the stuff that happens there, the easiest thing to do is to draw the glomerulus. So I'm going to draw my afferent arteriole. Sorry, I'm not an artist, right? And then my efferent. So this is the efferent arteriole, taking blood away. And then this is the afferent arteriole. Okay, remember that's bringing blood to the glomerulus. And then this is the glomerulus, and it sits inside the first part of our tubular pathway, which is the Bowman's capsule. And the Bowman's capsule has two layers, right? So this would be the outer membrane, the one that kind of makes the big circle. And then the inner membrane would sit kind of right on top of these capillaries. So you've got an inner membrane and your capillaries sort of forming this tangled mess. And then the outer membrane of the Bowman's capsule out here. So one of the things to understand about glomerular filtration, okay, this first part of urine formation, one of the first things to understand are the forces at work. So remember, we've got four Starling forces. We've got the hydrostatic pressure of the capillaries. That's going to favor, I'll put in a check mark for favor filtration. Then we've got the osmotic pressure of the capillaries. That's the one that's caused by all the solute that's in the capillaries, like plasma proteins. Okay, so this is going to oppose filtration. And then outside of the capillaries, we've also got hydrostatic pressure. So I'll say, we could say interstitial fluid or the Bowman's capsule. Bowman's capsule is a little bit more specific. Interstitial fluid is more general because it could be anywhere in the circulatory system, whereas this is specific to our glomerulus in the nephron. So this is our hydrostatic pressure. And so remember, this is a pushing force, but if we're outside of our capillaries, it's going to oppose filtration. And then we've got an osmotic pressure of the interstitial fluid or the Bowman's capsule, which is going to be a pooling force, so that would favor filtration. Right? So you want to know which forces are going to favor filtration and which ones are going to oppose it, and then also what they're determined by. So we know that the hydrostatic pressure in the capillary is determined by the blood pressure, ventricular contraction, okay, when our heart beats. We know our osmotic pressure of the capillaries is determined by how much solute is in the blood, right? This one, our interstitial fluid / Bowman's capsule hydrostatic pressure, that's a pushing back. This one would increase if you had more fluid out here. So let's say maybe there's a blockage somewhere in the tubular pathway that it causes fluid to accumulate. That would increase that type of pressure because then you would have more fluid out here and it would be pushing back on your capillaries. This one, the osmotic pressure of the Bowman's capsule, this is determined by how much solute we have. Okay, so solute's going to pull fluid towards it. So if you had a lot of stuff out here that acts as a solute, it would pull fluid towards it. Okay, so that could be something caused by infection. If you've got a lot of molecules building up or white blood cells building up out here, those are going to act like solutes, and so that would increase your osmotic pressure of the Bowman's capsule. So those are your 4 Starling forces that are going to influence glomerular filtration. So that's one of the first things that you have to understand about glomerular filtration, the 4 Starling forces. And then the other thing that you want to understand is the stuff that influences glomerular filtration rate. And so with glomerular filtration rate, we're going to use our afferent arteriole to either increase or decrease the amount of blood that's going towards our glomerulus. Okay, so here's my afferent arteriole. It's bringing blood into the glomerulus. There we go. We'll go with that. And then this is the efferent over here. Okay. Now, in order to increase our glomerular filtration rate, we need to send more blood here. That's going to increase our hydrostatic pressure of our capillaries, right? Because we've got more fluid coming into those capillaries, more fluid coming into the glomerulus. That's going to increase this hydrostatic pressure, and it's going to push more stuff out. Okay, so it's going to increase our filtration. So if we increase our glomerular filtration rate, we would need to first increase our amount of blood that's arriving to the glomerulus. And so in order to do that, we would vasodilate. Okay, so we would make that afferent arteriole bigger. Right, so several things are going to help us do this. One of the first things are going to be the parasympathetic nervous system. So this is part of your autonomic nervous system. You can think of parasympathetic as rest and digest. Everything's good, and we can afford to lose more fluid. The other option is our fight or flight, the sympathetic. Okay, so this would be wanting to hang on to fluid. Right, so for these two situations, the one that's going to increase our glomerular filtration rate would be the parasympathetic. And then if we want to decrease our glomerular filtration rate, because we want to hold on to all that fluid, we are going to do the opposite of everything we did up here. So now we would vasoconstrict, and that would limit the amount of fluid that's coming in. And then we would have less fluid, so we would have less hydrostatic pressure, and that's going to cause less stuff to come out and ultimately decrease our glomerular filtration rate. And that's good, because if we're in an emergency situation, we want to hold on to our fluid. It's going to help us maintain a higher blood pressure. It's going to help us hold on to our plasma volume, and so that's going to be ideal for coping with emergency situations.